Welcome to the Health and Wellness Conference. And today we are blessed to have Richard Zierkowski, Dr. Z, he told me that everybody can call him, for the relief back and neck pain. And I'm going to just tell you a little bit about Dr. Z. He's a graduate of the New York Chiropractic College, where he obtained his Doctor of Chiropractic in 1998. He's certified in the following: the Corin technique in 2007, the Kennedy decompression technique in 2008, the neuromechanical technique in 2009, and the Witten technique in 2014. He was the first to provide affordable decompression to Western New York. He's the owner of both Universal Chiropractic and South Buffalo Chiropractic. His chiropractic's focus is on cooperative multidisciplinary care, patient-centered quality treatment, and in-depth post-surgical spine rehab. His passion is in living a healthy lifestyle and encouraging his patients to do the same. His mission is to help ensure that his patients have the highest possible quality of life, to improve their health through their personal dedication and cutting-edge medical technology, to help them heal without surgery in the most affordable manner possible. I'd like to welcome Richard Z, or Dr. Z.
Thanks for having me here today. This is a great event. Hopefully everybody's able to pull some useful information, not only from my class, but all the other classes and vendors present today. For myself, I feel I was fortunate to be exposed to chiropractic at a young age. Not only to get a head start in life on helping patients, but to incorporate a lot of concepts and philosophies, to myself and for myself. And when I started looking into chiropractic, I always thought it was interesting on, how somebody can go to a doctor and the doctor can help them naturally, give them advice, on how to improve their health and their well-being, and help them with, neck and low back pain and a variety of other elements. And as I was putting material together today for this class, I was thinking, well, maybe I can, provide you guys with some useful tips and, some things that you can actually take home to help yourselves if you have, some neck or low back pain, but also maybe into, some basic tips on how to improve your overall health and well-being. So I basically broke the presentation down into three segments where, initially we're going to just talk about pain, and how the body is naturally designed to heal. And then we're going to get into a bunch of different, topics and different tips, that I'm going to provide, for everybody here. And then after that, I'm going to go into different techniques that are out there, and then hopefully we have some time for some Q&As. So the topic is relieving back pain and neck pain naturally. Okay, so I'm just going to go over some statistics with you first. Just kind of some of them are a little bit of an eye-opener. On how much, back pain can actually, affect people and how much is affecting our society in general. Worldwide, back pain is the single leading cause of disability, preventing many people from engaging in work as well as other day activities. Back pain is the most common reason for missed work. 1/2 of all working Americans admit to having back pain symptoms each year. Back pain accounts for more than 264 million lost work days in 1 year. That's 2 work days for every full-time worker in the country. Experts estimate that 80% of the population will experience back pain at some point in their lives. Okay. Back pain is also the 3rd most common reason for visits to your doctor, behind skin disorders and arthritic conditions. Most cases of back pain are mechanical or are non-organic, meaning they were not caused by serious conditions such as inflammatory arthritis and so forth. So what that means, most back pain is just brought on from maybe altered activities of daily living, maybe not having your body's healing potential, brought up to a certain, degree or a certain level. So that's pretty interesting. Most people think that back pain is brought on from some form of trauma, but most of it is just, certain things that, can be prevented. And that's what we're going to spend a lot of time talking about. A couple more stats we'll go over, and we'll talk about pain in general. But worldwide, years lived with disability caused by low back pain have increased by 54% since 1990 to 2015. Thought that was pretty interesting too. As our society is as we're evolving in society, why are we starting to become crippled more with back pain? I think if we look at what we're doing all day, we're on the computers, we're on our cell phones, we're not maybe as active as much as we used to. That could be why that number is trending so high. Low back pain costs Americans at least $50 billion in healthcare costs each year. And in lost wages and decreased productivity, that figure easily rises to over $100 billion. It's pretty amazing how much back pain affects us as a society. I don't think we think about that as much as as we should. But so we're going to get into pain and why we actually have it. Pain is an unpleasant sensation and emotional experience linked to tissue damage. And this is coming from Medical News Today. This is why I pulled it up for this particular sentence. Its purpose is to allow the body to react and prevent further tissue damage. So if you think about that, when you're having pain, that's your body's way of telling you, hey, there's something going on here. We need to address this. And I think what's happening as a society is well, let's just block that pain. It's I don't want to think about it. I don't want to deal with it. We live such a busy, hectic lifestyle that we don't have time for it. So I think we miss that component of why we have pain. It's our body's way of telling us, hey, there's an issue here. Let's try to focus on that. And then we feel pain when a signal is sent through the nerve fibers to the brain for interpretation. Our bodies are designed to heal. I think our bodies are amazing, are just amazing things to have. I mean, you can talk about computers, you can talk about advancements in technologies, but I think we overlook how remarkable, how miraculous our human bodies are. And I think we overlook the fact that we are naturally designed to heal. Just a couple of basic examples. If we cut our arm, we're not going to bleed to death. There's physiological processes that are going to take place that are going to help that cut. But then, we also have to be aware that, we do need assistance in certain times to promote our body's ability to heal. So say if that cut needed bandages, we need to assist our body to heal to maximize that healing potential. If we break a bone, break a bone in our arm, over time, that fracture will heal. Our bodies are designed to heal. But depending on the seriousness of that fracture, we may need, a cast to support it. So, I think it's important to understand that, our bodies will heal, but there's certain scenarios where we can help that natural process from taking, to take place. So when we develop neck or low back pain, we utilize medicine or different therapies to relieve the pain that's only facilitating the body's natural body to heal within itself. So we have neck or back pain, we want to use other therapies. It's important to think of those as to help facilitate our body's natural concepts or natural abilities to heal. So now I'm going to just go over some basic things that I think are overlooked, and these things are geared toward improving our overall health, but we hear these things, but on why we should do that. So I'm going to get into the reason behind it. But as we use these things to improve our overall health, they're also helpful to preventing back pain or neck pain, or if we have pain, to reduce that pain. So we talk about hydration. You hear that all the time. Do we drink enough water? A healthy person needs 30 to 50 ounces of fluids per day. Drinking fluids is crucial to staying healthy and maintain the function of every system in your body, including your heart, your brain, and your muscles. And the importance of being hydrated is it carries nutrients to our bodies. And one of the questions I always get from patients is, well, how much water should I really be drinking? If you're drinking a lot of products that actually dehydrate the body, like coffee, you need to increase that water intake a little bit more. And tips that I give to patients, to increase their hydration is, have a glass of water with every meal. There's 3 glasses right there. And then when you wake up in the morning, if you can't drink a full glass of water before your coffee, have a half a glass of water. And then maybe a half a glass of water at night. But there's different tips and tools that you can utilize just to make sure you're staying hydrated. And when you think about back pain, why is it important to stay hydrated? In between each of our vertebrae will sit our discs. Okay, everybody knows what a disc is. And our discs are made up of there's 2 layers. There's a cartilage ring, and then in the center part of the disc it's called the nucleus pulposus. And that nucleus pulposus is made up of water. So if it's mainly made up of water. So the more hydrated we are as a person, the more hydrated that nucleus pulposus is. So when somebody has chronic back pain, and we're going over a lot of different reasons why they're having it, and I ask them, well, are you drinking enough water? They're like, I don't drink water. Well, that could be a component of why they're even there in the first place. That nucleus pulposus is craving water, craving to be hydrated. And if you think about it, over the whole layer of your spine, if each disc is dehydrated, or that nucleus pulposus, doesn't get fully hydrated, we start to shrink. So when we get older, our bones don't actually shorten. It's those discs that are losing space because they're not fully not fully hydrated. So if you ever got an X-ray of your spine or an MRI, and you start to see that disc space is narrowing down, it could be that you haven't been hydrated enough to keep that nucleus pulposus full. So then we talk about sleep. When you close your eyes and you fall asleep, your brain can attend to other issues within your body. If there are areas that need to heal, the brain can trigger the release of hormones that encourage tissue growth and repair blood vessels. This helps wounds to heal faster and also restores our damaged muscles. While you sleep, your body can make more white blood cells that can attack viruses and bacteria that can hinder the healing process. So when we're sleeping, our bodies are actually healing. And, and I think, like we talked about earlier, we're caught up in this busy lifestyle. I don't think we put enough value to our sleep. And the common question I get with patients, well, how much sleep do I need? And everybody's different. The textbook is going to say 6 to 8 hours, but the way I look at it is, do you feel tired? If you're tired, that's your body's way of telling you need more sleep. If you feel like you need to drink coffee or caffeinated products throughout the course of the day to keep yourself alert and awake, that's your body's way of telling you need sleep. And you could be missing out on your body's ability to heal because we're not getting proper sleep. Talk about diet. Diet is a very important, plays a very important role in back pain and overall health. I'm sure you're aware of that, but I'm going to go over like certain foods and certain things that you can actually eat that can actually help you with back pain and inflammation. Doctors are learning that one of the best ways to reduce inflammation lies not only in the medicine cabinet, but in your refrigerator. Following anti-inflammatory diets, you can fight off inflammation for good. And there are foods that you can easily incorporate into your diet that can reduce inflammation. When we talk about berries, berries are very beneficial, because they contain certain antioxidants that reduce inflammation, but also train our cells to repair faster and fight inflammation. So when you're at the grocery store, maybe pick up some berries, when we think of food, we don't necessarily always have to think of food as, well, I need to fill a void. I need to eat just because I'm hungry. I think it's important to start thinking of certain foods that can actually help you with certain conditions that you have. And berries are a great source to reducing inflammation. Who doesn't like berries? Berries are easy to eat. Blueberries, strawberries, raspberries, blackberries. When we talk about leafy greens, we know that they're good for us, but why? We look at spinach, kale, Swiss chard, arugula, dandelion greens, and other leafy greens. They're all rich in antioxidant and they're alkalizing to the body. So what that means is they're going to also help with reducing inflammation, but also increasing the body's potential to heal. So having a salad, when you're eating a salad, don't think of it, well, I'm just eating these greens maybe because I'm on a diet and I want to lose weight. Look at certain greens that are actually going to be beneficial to you, that are going to actually help the body as a whole, not just fill that void. Then we talk about certain fishes like salmon, trout, sardines, anchovies. these foods contain, omega-3 fatty acids, which also are significant in playing the role in reducing, anti-inflammatory processes. And, if you're gonna, eat a lot of fish, the only recommendation I always give to patients is, you want to try to eat more wild caught than farm-raised fish. If you have, like 1 or 2 servings of fish a week, you're supplying your body with nutrients that it's craving. And again, just think of, when we're eating, when we're grocery shopping, we're putting meals together, just think of, as we're preparing these foods, to help our bodies heal. Avocados are amazing. They're a healthy fat. They're loaded with monosaturated good fats, the kind which help reduce cholesterol and soothe inflammation inside of our joints. A lot of times people are like, well, how do I eat an avocado? You can mix that into your salad, but what I'll do is, I'll mix that with different fruits or even vegetables, and I'll make a smoothie, and it actually tastes pretty good. But incorporating an avocado or 2 into your diet on a daily basis is going to help facilitate your body's ability to heal. Broccoli is something I don't like to eat, but I have to mention talking about it. But it's a cruciferous vegetable like cauliflower, Brussels sprouts that are jam-packed with antioxidants, vitamins, and phytochemicals. Broccoli is one of the most studied, or sulfurine is one of the most studied compounds in broccoli. It is shown to have protective effects against cancer, detoxifying harmful chemicals from the environment that would otherwise trigger inflammation to the body. Let's see here. And a couple other foods, or a couple other herbs that I'll talk about. Garlic, adds a lot of flavor to the body, but it actually naturally inhibits histamine and sulfur compounds that stimulate your immune system. So by eating garlic, you're actually fighting disease, and there's actually studies that show it can reduce inflammation and help damaged cartilage. Ginger contains a substance known as gingerols that reduce inflammation and turn off pain-causing compounds in the body. So I hopefully, I know I went through that pretty fast, but I'll give you my email address when we're done. If anybody has any questions, I can elaborate a little bit more on that for you. But the main purpose of talking about the diet was, again, thinking of it as what we can do to help ourselves. And the foods that we talked about were specifically geared for inflammation, but maybe somebody has heart disease, or maybe somebody has high cholesterol. Take a look at certain foods that can actually assist you with those pathologies to strengthen your body's ability to heal, specifically against those specific pathologies that you may have. Okay, so we talk about stress. Stress is one of the most complicated components that I deal with patients, because I feel it plays a huge role in why they're in pain, but sometimes it's the hardest thing to get rid of. Stress. It could be family, it could be job, it could be financial. Those are things that we have to deal with on a daily basis. But I think how we deal with them is important, because sometimes we just can't eliminate stress from our lives. When we're under stress, it actually constricts the blood vessels and reduces flow to various soft tissues, including muscles, tendons, ligaments, and nerves in the neck and the back. This causes a decrease in oxygen to the area, as well as a buildup of biochemical waste products in the muscles. And in turn, this results in muscle tension, spasms, back pain, a lot of back pain experienced by patients. So, like I said, I think it's overlooked a lot when we're dealing with, health issues, but I think it's something that, we need to kind of address as an individual, is, how we can help manage this. One of the easiest and safest ways to reduce stress is through meditation. Meditation is gaining a lot of popularity. If we talked about meditation, even like 5 years ago, you might have looked at me like, what's this guy? This guy's crazy talking about meditation. But now it's starting to become more mainstream. And meditation is a natural way to reduce stress. And if somebody's never meditated before, all you really have to do is go to YouTube, click on meditation music, play it for a half hour, 20 minutes, and then when you're done, you actually start to feel relief. But A lot of these things, they're great to do once, but it's good to incorporate that into your lifestyle, and that's a key, thing to think about when we talk about, foods and reducing stress and exercise and so forth. I think a lot of times we roll up our sleeves and we're like, okay, let's do this, but also try to create it or try to implement it in a way that it's going to become a routine for you. And that's going to be key because, a lot of these things are great, but if you can incorporate them long term, that's when you're going to get the results. Just by eating, a couple healthy meals and, reducing your stress, a couple days here and there, they'll help, but the message I'm trying to get across is how can we incorporate that into our busy lifestyles where it's going to have the long-term effects? Because a little bit over time is where we're going to see the value, and maybe it's only 5 minutes a day. Whatever you can incorporate into your lifestyle. Other ways, going for massage, yoga, neurofeedback. We'll talk a little bit about that, and it leads into exercise. Exercise is great to reduce stress, but it can also help benefit with chronic low back pain. It increases blood flow and nutrients to soft tissues in the back, improving the healing process, reducing stiffness that results in back pain. There are a variety of ways to get exercise, but the key is to find a form of exercise that doesn't increase or produce pain. So everybody's different. Somebody can go out and tomorrow and run a quarter mile or a mile. Somebody might just have difficulty, a patient might just have difficulty getting out of their chair. But just because everybody's different doesn't mean that we can't do something. And if you're really struggling, just doing basic exercises like walking, it's very overlooked. People say, well, I can't do things, I'm in so much pain. But you want to try to do as much as you can before you start to increase that pain. And if you're in that much pain where you can't even do any basic exercises, it's good to consult somebody who specializes in implementing exercise to help you at least get started, whether it's a chiropractor, physical therapist, or even your primary care physician. You want to try to get moving to get that blood flowing because that's an important component to the healing process. So I put together a little Q&A here for everybody. I think, does everybody have pens? Amount of pain. Okay, and then let's mark that from a scale of 1 to 10 now. When you're doing your activities of daily living, say if you're doing yard work or you're doing things around your house, you're cleaning up. On a scale of 1 to 10, how would you rate that? And then also, on a scale of 1 to 10, how would you rate your pain if you had to do something, physically exerting? So maybe you had to, lift some heavy boxes, or you maybe had to help somebody move something. How would you feel after that? So now what I want you to do is take the average of those three. So just add them all up and divide it by 3. And that's general tool, a good way to gauge how much pain you're on an average day. Some people might be lucky enough to only have 1 or 2. Most people fit into that 5 or 6 category. But then there's unfortunately, there's some people that are in the 7, 8, 9, and 10s. Okay, does everybody have that average calculated? Okay, so now let's take a look at our overall health and how we're applying some of these tools that we talked about. Are we applying those to our lifestyle? So let's look at hydration. If we feel like we're fully hydrated and we're drinking a lot of water, we're not drinking a lot of caffeinated products, you're reaching your hydration goals, give yourself a 1. Okay, and if you feel like, man, I'm thirsty a lot, but I just don't like water. I drink a lot of coffee. I don't drink water with my meals. I drink a lot of pop. Rate yourself a little bit higher, closer to 10. If you feel like you're somewhere in the middle, rate it accordingly. Okay, now let's do the same thing with sleep. Okay, if you feel like you're getting a good, 6 to 8 hours of sleep, and you wake up feeling refreshed, every day, and you have a consistent roll of that, give yourself a 1. Okay, but if you're feeling like you have trouble falling asleep at night, there's so much on your mind, so much going on, and you're not getting good quality sleep. You wake up tired every morning. You feel like you need to have a glass of coffee to get yourself going. You need coffee in the afternoon to keep yourself going for the rest of the day. Then you're on the higher scale there. Give yourself a 10, closer to a 10. And when we look at our diets, are we eating foods that are healthy for us? Or are we eating a lot of fast food? Are we eating processed food? You know, if you're eating a lot of processed food, unhealthy foods, you're going to be on a higher scale. If you feel like you're getting, you know, have a pretty clean diet, and you're giving yourself a lot of fruits, vegetables, natural, you know, good sources of protein, give yourself a 1. Okay, now let's talk about stress. You know, are we managing our stress properly, or do we just kind of, you know, shrug it off and go on with our days? And if you feel like you do manage stress properly, are you doing, you know, maybe some form of meditation or yoga or exercising to reduce stress? If you're managing it properly, give yourself a 1. But if you feel like I really don't do nothing with stress, I just kind of bottle it inside, and I'll deal with it when I have to deal with it, you're going to be on a higher scale there. And then we talk about exercise. Are we staying active? I'm not saying is everybody, you know, running a marathon, or is everybody, you know, going out and running a mile every day, but are you doing something on a daily basis to keep yourself active? And if you are doing that, and you're staying active, and you're doing, you know, exercise to improve your health, give yourself a 1. And if you're not, you know, if you feel like, well, maybe I can start doing, I should do a little bit more, maybe you're about a 5. If you're not doing anything, you're a 10. Okay, so does everybody have numbers for all those categories? Okay, so now add all those up and divide that by 5. I'll give you guys a minute or two. And the point of this is I want you to see, is there a link between what am I doing for myself on a daily basis, and maybe this is why my pain level is so high. Okay, maybe there's certain things that I can do to help my body, you know, heal naturally. You want to be that cast. You want to be that, you know, for a broken bone. You want to be that bandage for a wound. What can you know, are you doing certain things to help yourself heal? Because getting back to what we talked about, our bodies are designed to heal. But let's give it some tools. Let's feed our body with some helpful things to help it heal. And I thought this was interesting because maybe maybe somebody's pain level is high, and there's something on that other end that is high too, where maybe you overlooked it. And you know, and as a doctor, you know, it's our responsibility to kind of dig into all these little things, because I can have a patient that comes in and I'm doing everything for them, and I'm like, man, why aren't you getting better? And I may have not talked about stress. Maybe there's a lot going on in their lives, and you know, I can adjust this patient. They can exercise, they can eat all the proper foods, they can stay fully hydrated, they can get proper sleep. But if they're not addressing, you know, stress properly, you know, their body's not going to reach their maximum potential. So there could be something missing, you know, in your lifestyle that's not maybe just causing you pain, but also leading to other health issues. So I thought this was an interesting tool, just to kind of, you know, create a little bit of awareness to yourself that, hey, maybe if I start doing some of these things, my back pain will reduce, or I'm going to be able to do, you know, a little bit more for myself. So I just want to keep an eye on time here. Okay, yeah, I figured I'd be done at the halfway part, and we're right there. So now I'm going to talk about different techniques, you know, that are out there. You know, and it's not just for chiropractors. It's, you know, there's other, you know, therapists out there. Physical therapy is great. There's a lot of therapies that you can use to, you know, to help yourself, you know, facilitate that healing process. So I always say the first thing you do is you want to start with yourself. What can you do to help yourself? And if you're not reaching your goals, okay, maybe we need a little bit more assistance. And I'm going to kind of talk a little bit about, you know, other forms of therapy. You know, chiropractic, you know, obviously I'm a chiropractor. I've been doing this for 20 years. I love chiropractic. I can talk about this, you know, all day long. Chiropractic is great. It helps, you know, align the spine. It helps improve mobility in the joints. And the key component that I think gets overlooked with chiropractic, it actually helps with the function of the nervous system. Once your spine is aligned properly, your nervous system is working better, that also helps with the body's healing processes. So, you know, I don't want to sound biased to chiropractic and talk all about chiropractic this whole time, but I want to just touch base that, you know, there's a lot more to chiropractic than just, helping somebody with their neck or their low back. If you go to a chiropractor that has a really strong philosophy, their philosophy should be, okay, I'm going to help you, with your body as a whole. And a lot of times, patients get apprehensive going to a chiropractor because they're afraid, of getting manually adjusted. Some people just don't like it. Not everybody was, wired to like a full forceful manual adjustment. And that was one of the things in practice that over the years that I kind of felt odd. I love manually adjusting patients. I feel there's a lot of benefits to it. But then I was like, there's just people that just don't like that. And I was like, well, what can we do to help these patients reach goals through chiropractic care by not just getting manually adjusted? And that's where, the beauty of chiropractic adjusting tools come into play. They're highly researched, highly effective. The key to them is they deliver a high-speed, low-force impulse into the spine that creates a certain response. And I'm going to throw some clinical terms out there, bear with me, but they stimulate a group of cells called mechanoreceptors. So when we look at the joints in our body, we have cells that are constantly firing. We have nociceptive cells that are firing, and we have mechanoreceptive cells that are firing. If we have more nociceptive cells firing than mechanoreceptive cells, the joints tend to be more irritated, inflamed, arthritic, painful. Adjusting tools are specifically designed to activate these mechanoreceptors. So when you're getting adjusted with an adjusting tool, we're not really using that to just put vertebrae back into place. That specific frequency that is developed with these adjusting tools activates these mechanoreceptors, and they're very beneficial. And to me, I was a little skeptical at first because I felt, I'm a chiropractor, I'm going to use my hands. And when I started incorporating it into my practice, I adjust everybody with an adjusting tool now. Mainly I'll do the manual stuff, but I'm using the adjusting tool in conjunction with it because I see the results of it. So, so if you're ever apprehensive going to a chiropractor because you don't want to get manually adjusted, call up the office that you're interested in going to and say, hey, does this chiropractor offer other techniques than just the traditional manual adjustment? Do they use adjusting tools? So don't be afraid that you just have to every time you go to chiropractor you have to get manually adjusted. Spinal decompression, it's gained a lot of momentum over the last 10, 15 years. And spinal decompression is geared toward patients mainly with disc herniations. And it's interesting, when we think about disc herniations, if we get diagnosed with a disc herniation, we think it's the end of the world. The fact of it is, say we did MRIs on everybody in this room, when we're not even paying attention to how much pain you're in, we're not looking at that. Half this room is going to have some type of a disc injury, whether it's a minor disc bulge or a disc herniation, and the other half of the room is not going to have that. So if you get diagnosed with a herniated disc or a bulging disc, don't feel like you have to run off and get surgery and it's the end of the world. There's a lot of people out here with herniated discs that won't even have a symptom from it. It's when these discs become symptomatic is when they become a problem, when people start to panic and like, oh my gosh, I have this herniated disc, I have to get surgery, I need to get this pain block, I need to get this medication. Take a step back. There's different tools out there that you can help with those symptoms from those herniated discs. And I started implementing spinal decompression into my practice about 12 years ago, and it's been a lifesaver. The amount of patients that that get relief with spinal decompression with herniated disc it's amazing. So not to say it's going to help everybody. Sometimes there are scenarios where people do need surgical intervention, but just don't think if you have a herniated disc it's the end of the world, because it's far from it. Massage techniques. When we think of massage, we just think of going to a massage therapist, which are great. I go to massage therapists once a month. We have them in our office. But there's different things that you can do to help yourself with massage also. There's just massage tools. We talked about stress reduction. If you get a massage tool, put it on your shoulders. Periodically, that's going to reduce those tensions the tension that's building up in your muscle, and can help reduce a lot of neck pain. And even from the chiropractic and the physical therapist perspective, there's even advancements in techniques that, that we're being exposed to that we can implement into practice. One of the most common ones now is called Groston technique. It's actually a tool-assisted massage. It expedites the process of getting a massage. So instead of having to go for, if you don't have time to go for a massage, half hour massage, Groston can be facilitated within 2 to 3 minutes, and is very effective in reducing adhesions and trigger points, or knots in your muscles. So explore different options for massage. But massage therapy is a great component to reducing muscles tension, but it also helps reduce stress. Cryotherapy, cold therapy, applying ice to an injured area. A lot of times I'll hear patients, yeah, my back was sore, I put heat on it. Why did you put heat on it? Well, it felt good. Okay, but unfortunately, sometimes what happens when you're applying heat, sure, it can get the muscles to relax, but especially if it's over an inflamed nerve or over your spinal cord, you can actually be increasing inflammation, and that could be the source of why you're actually having that pain. So for me, I've always been an advocate of cold therapy. Even just putting a cold pack on, 20 minutes on, hour off, 20 on, hour off. Do that a few times for a few days, and then you'd be surprised the results you can get from that. When I talk to patients about ice, they say, yeah, I put a cold pack on, it didn't do much. Well, how many times did you put it on that day? Yeah, once. Well, yeah, it's not really going to be that effective if you just put it on once or twice. It's using it 2-3 times a day over the course of time. That's where you're going to get your benefits from ice. One of the things I don't know if anybody's heard of it are the cryosaunas. Cryosaunas are pretty cool, no pun intended. But they reduce inflammation systemically. We actually have one in our practice. I know there was one downtown in Buffalo. I know there's a doctor in Orchard Park that has one, and they're starting to, I think there's even one in Depew and Lancaster now. So they're starting to gain momentum. I was first exposed to one at my chiropractic convention a few years ago, and I'm standing inside the cryosauna, and I'm thinking to myself, well, at first I was like, wow, this is pretty interesting. Maybe it's something I can incorporate into my practice. So I'm standing inside this, and after the first minute, I was like, wow, if I brought this to my practice, my patients are going to think I'm crazy. It's that intense. It's that cold. But when you come out of it, it's very invigorating. And when I walked out of the cryosauna, I was like, wow, there's something to this. My joints feel a little lighter. I feel like I was just revitalized just after being in this cold temperature for 3 minutes. So I started doing a little research on it, and eventually, I incorporated it into the practice. But I think cold therapy is overlooked a lot, and that's something that you can implement on your own. Yes?
Is that dry ice?
No, it actually is. No, he's inside of the chamber, and there's liquid nitrogen that gets converted into a vapor, and it's the vapor that's actually cold.
So roughly, what's the temperature?
You're at around negative 220 to 260. Yeah, and people ask me, how can you actually survive in that temperature? And I'm not going to sugarcoat it. It's cold. It's the coldest place in the world, essentially. But if you think about it, okay, when we're outside and it's negative 10 degrees, negative 15 degrees, and out here in Western New York, our head is exposed to that cold temperature, and we're breathing that in, and that's why negative 10 degrees or anything cold feels that cold. But when you're inside the cryosauna, your head is exposed to room temperature air, and you're breathing in room temperature air. So it's cold. Your body's going to be cold, but physiologically, it's not going to have negative effects on the body because you're breathing in room temperature air, and you're only in it for 3 minutes. So I don't know how much time we have, but there's a lot of physiological changes that happen to the body, with being in the cryosauna. I could talk about that for a whole hour, but I'm going to move along. But I just wanted to, the purpose of talking about it was to, let you know that there are a lot of options out there, to reducing pain and inflammation naturally. Cold laser therapy. Cold laser therapy is interesting, and I think you're going to start seeing a lot of this type of concept trending over the next 3, 5, 10, 15, 20 years in regards to pain management and tissue healing. It's one of those things that's kind of people wonder how effective it is because you don't feel anything. Okay, essentially it's an infrared light that penetrates into the tissue, and it actually helps heal at the cellular level. And when I'm talking about like what you're going to start seeing over the next 3, 5, 10 years is there's going to be a lot more therapies out there that are healing at the cellular level. We ever watch some of these old sci-fi movies where somebody's injured and they lay on a table and somebody presses a button and they jump up and they're healed, and but I don't know if people get into sci-fi. I really don't, but you're gonna start to see that technology is going to make its way into the doctor's office, and it's going to help heal at that cellular level. So the cold laser, what that specifically does, it sends an infrared light into the cell, and inside of our cells, we have our mitochondria. Okay, that's like the powerhouse of the cell. And when that infrared light hits that mitochondria starts to produce more ATP, and that ATP essentially makes that cell healthier, more vibrant. And when we look at pathologies or illnesses, no matter what it is, whether it's a soft tissue or something with our heart or our digestive tract, we should look at what is the cellular health of that particular organ or that particular tissue. The healthier our cells are, the healthier we are as a human being. And healthier cells are actually fighting off or getting rid of unhealthy cells that are just taking up space and creating inflammation and and that are increasing pain in that area. So cold laser therapy is a great option to reduce inflammation, but also heal at the cellular level. My last convention I was at, our chiropractic convention, there were 3 different other therapies out there that are healing at the cellular level. And I go to my convention every year, and what I'm starting to see is, that's where the trend is. And what I always look for when I'm, obviously I'm going to research, different therapies, but I like to see which therapies are standing the test of time. Sure, anybody can say this is going to do this or this is going to do that, especially if you don't feel it, after one session. How do you know if it really works? But when you start to see these types of therapies making their way into these conventions year after year after year, to me that tells me there's some value to it, because people are actually utilizing it. If people are utilizing it, they're getting results. And so I've been going to my conventions since I can remember, but now it's pretty interesting that I'm starting to see a lot of these techniques that are healing at the cellular level. You might not be exposed to it now, but like I said, 3, 5, 10 years down the road, you're going to start to see more of these therapies being implemented through different doctors and physicians that you see. Neurooptimal. I brought the Neurooptimal unit into my practice a few years ago, mainly to help with stress reduction. The Neurooptimal is actually neurofeedback. Essentially, when you kind of sit in a relaxed environment or relaxed sitting, and there's an EEG unit that actually hooks up to your cranium that picks up like any aberrant firings, and it sends a signal to your brain to get your brain back on track into a more of a relaxed setting. So if you're under stress or you feel like you're trying everything you can, and stress is a component of your pain, Neurooptimal or neurofeedback could be an option. And again, this is another cutting edge technique that's starting to gain momentum in the health and wellness industry. Posture and ergonomics. These are things that we really need to talk about and look at as a community as a whole, because from that one stat that we talked about earlier, the drastic increase in neck and low back pain, as we're evolving, why are we having all these issues with our back, and why is it creating so much a financial strain on our environment? And we talked about what are we doing all day. So not to say that you can't sit at a computer all day, you can't use your cell phone, you can't play kids can't play video games, but what you want to do is take a little bit of a break or a little bit of a time out and take a look at what you're doing, how you're sitting, and improving your posture and improving your ergonomics is something that, if done with consistency over time, can make huge improvements, not just on the way we look, but on the way we feel. One of the interesting things about sitting in a crouched position, if you think about it, you're reducing your lung capacity. Okay, so if you're sitting and doing this all day, kids are on their computer all day, you're not reaching the full benefits of what your lungs should be doing, because they're squished. And if you're not doing that, we're not getting proper oxygenation to our body. So a society that's going to be doing this all day not only is going to be prone to having neck and back issues. But by not getting proper oxygenation to our bodies, we're decreasing our body's ability to heal and reach our our full potential as what we were designed to do and what we're designed to be. And one of the things we do in our office is we'll actually take sometimes take photos of patients in a neutral standing position or to their side. And looking at them at their side, and if you can even do this on your own. Have a significant other, or a friend. We're always taking pictures of everything on our cell phones. Let's take a picture of ourselves and take a look at our postures. Look at ourselves from a front to back. Is one shoulder a lot higher than the other? Are we leaning toward one side more than the other? There could be some type of a structural imbalance that's causing that posture. To do that, now if we take a look at our posture from our sides, have somebody take a picture of it. Our ears should be lining up with our shoulder, or our hip, and our knee. What we're starting to see a lot, it's called forward head carriage. People, they don't realize it, but they're walking around like this. Why are they doing that? Because half of the day they're like this. So their muscles and their ligaments are getting trained to be in that flexed or that fixed position. And then when we start to get up in a neutral upright position, our bodies and our muscles are going to be so used to doing that's what's going to happen. So, take a look at your posture from the side. And there's a lot that you can do to offset that. And again, when we talk about making these changes in our diet and exercise, nutrition, even posture, I always like to talk about consistency over time. Okay, sitting up straight for 1 week isn't going to fix your posture. Sitting up straight, over the course of time, or taking a break from, from your computer, every hour or every half hour, just bringing up your shoulders, bring them back, let them relax, open that up. Do the opposite of what we're doing. Those tips and tools over time can play a huge role, not just on the way we look, but also on how we're feeling. We get patients that come in with neck pain all the time. Again, we covered everything, but we're not addressing ergonomics. We're not adjusting their posture. We need to address those types of things to help them reach their full potential. Yoga and Pilates is great. We don't have yoga and Pilates in our practice, but I tell patients all the time this is a great tool to implement into your lifestyle to one, reduce stress. And you get yourself relaxed, and it also improves flexibility and also core strengthening. So, I have a friend who's a yoga instructor, and she would always say, people who say that they can't do yoga the most, like I can't do yoga, I couldn't even imagine doing that. Those are people that need it the most. So if you're one of those people that say I can never do yoga, you should be first in line. Be honest with you, and call around and look for a class that, hey, is there, do you have a beginner class? I'd say I've never done yoga before. I have neck and low back pain. I was suggested that yoga could help. Do you do this? If not, do you know somebody that does? And there's a lot of resources out there where you can start to get your foot in the door with yoga, and then eventually into Pilates. So that was really all I had. I want to see how much time I have. We got like 10 minutes. I wanted to spend some time, talking to you guys if anybody had any questions, in regards to, different therapies or different things that, maybe you can do to implement into your own lifestyle. Sure. Stenosis. Yeah, stenosis is probably one of the more complicating conditions as a chiropractor. And great to start off with that question. No, but stenosis, it can be helped. Okay, stenosis is one of those things that can't be fixed, unfortunately, and it depends on what type of stenosis you have. You can have central canal stenosis, which sometimes is a congenital, pathology that we're dealt with, or sometimes you have what are called intervertebral foramen stenosis. That's where the nerves where the nerves exit the body. Those canals start to decrease over time. That's the central stenosis. So then that's the one that's the more complicated one. So great, thanks. But what you can do, it's not the end of the world, okay? And getting back to what we talked about, let's MRI half these patients. Let's MRI or all these patients. Half these patients have herniated discs. Half these patients don't. There's people that have stenosis, central canal stenosis, that are asymptomatic. Okay, so what you could do is start looking at different things to improve your overall health and your lifestyle. And specifically, for stenosis, what I tell patients is implement some range of motion, okay, into your back, into your spine. You know, movement is key, especially when in the back when you have stenosis. If you don't, you know, unfortunately, when stenosis gets bad, it's hard to move, and that's you know, that's where it gets complicated, because if you can't move, okay, and you're not moving, stenosis can progress. So what I'll tell patients in scenarios is like that is just do simple range of motion exercises. You know, just standing up or sitting up nice and straight, slowly turn to the left, and you want to listen to your body. Okay, so when you turn, and this is good. This is a good tip for anybody who's suffering from severe neck or low back pain, whether it's stenosis or not. But if you turn to the left and you start to notice an increased amount of pain, that's your body's way of saying, hey, you went a little bit too far. Okay, so now when you go to the right, pay attention. How far can you go? Ooh, that's sore over there. Okay, went a little bit too far. So now when you go back to the left, mentally remember where you were and go just right before it. And even if it's a few degrees. Okay, you want to try to implement that pain-free motion to those joints. And you start doing this over and over again, consistency over time, you're going to start to see, oh, I went 5 more degrees without having pain, both ways. And then eventually, you know, you're going to start to get full range of motion in your neck and your lower back. And again, that's great for stenosis or anybody who's having, you know, chronic neck or back pain that feels like they can't do anything. Range of motion is a great place to start. But the key is pain-free. Once you're implementing range of motion to the point where it's painful, you're starting to spike some inflammatory responses. So hopefully that helps. But any other questions? Yes.
You mentioned the problems with sitting at a desk all day.
Yes.
Do you have any opinion on the stand-up desk?
I love it. I love it. Yeah. And one of the things, you know, and I'm starting to write more doctor's notes for patients to take to their employer to have a standing desk, and I'm all for it. Well, one of the things too you want to keep in mind is, sure, you know, you don't want to be seated, but now if you're standing, you want to make sure you're standing properly. Okay, so when you're standing all day, okay, or how many hours you're going to want to do it, you know, I'll tell patients, you know, break it up a little bit. And if you have the option to sit and stand, it's going to be great, because now if you have to stand for 8 hours, what are you going to do? Okay, now what are you doing? You're going to end up with an SI or a hip issue. So when you're standing, one of the important things to think about, and I'll tell patients, is put equal weight into both feet. Okay, you don't want to shift. And if you feel like you're shifting, that means you need to take a little bit of a break. You're standing too long. And another tip, not just putting equal weight into both feet, is give a little bit of a bend in your knees. And when you do that, you start to engage other muscles than just the muscles in your back. Right now I'm using my quadricep muscles, I'm using my calves, I'm using my glutes, so I have a strong stance. So if you're going to be standing for an extended period of time, stand in the way. If someone's going to come push you, you're not going to move. If you're standing and someone's going to bump into you, you're going to fall over, you're not using your auxiliary muscles. Now you're starting to use you're using your back muscles more. So I think it's a great option to implement, you know, into a work setting where where you can do both, or you can do one or the other if you're using them properly. Digestive issue, you always want to look at the source, okay? And you know, and this is an individualized, you know, answer. So so we have to look at, well, why do you have this? Okay, why are your discs degenerating? And these are the questions that I would be asking you. And you know, most common answers are, you know, I don't know. It's just the way, just over time, you know, this is what happened to me. So you know, you want to cover the basic fundamentals that we talked about. But degenerative disc disease specifically, I'm looking at hydration. You know, how much water are you drinking? Usually if these discs are going to start to break down, you know, that nucleus pulposus isn't hydrated the way that it should be, and you're going to be prone to disc disease. Another common thing is, you know, posture. Okay, you know, when our posture is off, you know, over time, it creates a specific strain or an imbalance in certain areas of our body that wasn't designed to handle that particular positioning. So maybe that particular posture has put extra strain on those discs that's caused that disc to degenerate. Supplementation is good. You know, glucosamine, you know, is a good supplement to help slow down that degenerative process. But even looking at your diet, putting healthy foods into your diet and eliminating the healthy foods out of, taking those out of your diet. So there's a lot that can be done. Unfortunately, when something is degenerated, whether it's your disc or there's an arthritic condition that's taken place, you just can't take an eraser and say, okay, I'm going to get rid of these arthritic conditions. But you can slow that process down, and you can manage it accordingly. I always like to try to see, well, what's the root of it? And then if we know what the root of it is, let's focus on that root of why this is happening, and then that's where some positive changes can take place. I just want to keep an eye on time. Maybe I can grab one more question. Yep, we got 2 minutes left, so take one more question. Oh man. All right, you still kept your hand up, so you must have a real good question. Yeah.
CBD oil. Oh, I'm sorry.
CBD oil, yes, it's a great question. And I'll take yours too. If I go over, they're not going to throw me out, I don't think. But anyway, CBD oil, yes, I'm an advocate of it. Unfortunately, for some reason in New York State, we're not licensed to sell it in our office. And the reason for that is, I believe that maybe there's some type of contraindication with certain medications. And and as chiropractors, when we go to chiropractic college, our first years, we're right on pace with like the medical profession and what we're studying from anatomy and physiology, and then we branch off into adjusted techniques and different things specific to chiropractors, whereas the medical profession, they get more involved in pharmaceuticals. So we don't have that pharmaceutical background, so it's tough for us as chiropractors to say this is great for everybody, because there might be something, some type of medication that you're taking that we're not aware of as chiropractors, because we don't have proper training in it to say this is great for you. But in general, for most people, I'm a fan of it. I think it's a natural way to help heal the body. And I think you were the other one, yes.
Yeah, just in general, what
Yeah.
can you tell me about trigger points?
Trigger points, yes. Trigger points. So what a trigger point is? Okay, that's a good. We'll start with that. Trigger point is an accumulation of lactic acid in a muscle. Okay, our muscles have a specific amount of lactic acid in them that's supposed to help our muscles work properly and naturally throughout the course of the day. When a muscle gets overused, or there's injury or trauma to the muscle, lactic acid is going to formulate a trigger point. And those trigger points are actually in a way designed to help that muscle compensate for that particular injury. So whatever that source of why that muscle is doing it, why that lactic acid is accumulating into that trigger point, should be the number one reason why, the number one focus of why we're treating that trigger point. Okay, maybe it's posture or whatever the case may be, but there's different things that you can do to relieve, the effects from trigger point. So, massage is great. Now I talk about those massage tools. Putting that on a trigger point for a minute, waiting a couple minutes, reapplying it again, take a break, do that like 3 times. Okay, that's going to help disperse that lactic acid. Now when you start to get that lactic acid dispersed, the next thing you need to do is start to drink a lot of water. Okay, when you go for a massage, the massage therapist should always tell you, make sure you drink a lot of water. And the reason for drinking that water is to help keep that lactic acid spread consistently throughout that muscle. If we don't drink a lot of water, that lactic acid is going to formulate right back to that trigger point. But again, working on your trigger point is great to help reduce tension, but then you also want to look at, what the source of that trigger point. Why are you getting that trigger point? Why is that muscle having an imbalance? Why is that developing? Okay, all right. So I think I'm done for now. I'm going to be hanging out at the booth over there if anybody has any specific questions. So is this helpful?